welcome to Village in Motion. It is Wednesday, September 19th. I'm Clint Lambert. It's my pleasure today to be the host of this show. And for the next 30 minutes, I hope you pay attention because there's some important information coming forward. And then after that, go outside and enjoy this beautiful weather. Oh, what a gorgeous day in the neighborhood it is. But first, let's talk about outpatient rehab with Lisa Francisco, who is a physical therapy assistant. And we're very glad to have you with us this morning, Lisa.
Thank you for having me.
You've been at Green Spring for a number of years.
16 years.
16 years.
Yep.
And you've worked outpatient, you've worked some inpatient.
And now I'm helping home health.
Wow.
So I'm walking around the community.
And you kind of know your way around here, don't you?
Yeah, I found some shortcuts that I didn't know before, so that's a positive side.
What do you actually do in physical therapy?
So I'm a physical therapist assistant. So that's a 2-year education in a certified registered physical therapy program.
Okay.
So once a patient has been evaluated by a physical therapist, then I will take over the treatment based on the plan of care that they have developed.
Okay. And my understanding is now, because of new Medicare rules and regulations, that an individual that's on Medicare must be assessed by a physical therapist, not by a physical therapist assistant, prior to getting physical therapy. Otherwise, Medicare won't pay. Is that correct?
Correct. So we do a progress note every 7th day.
Okay.
So the evaluating therapist will follow up with the patient and see where they are, and then write a progress note to indicate where they are at that time based on the plan of care.
Okay. So the process is an individual goes in and sees a physician, gets an order to go to physical therapy, right?
That is correct. And
with that, they then see a physical therapist for what, an hour initially?
It could be between, a lot of times it's 90 minutes.
Okay.
Because the first initial eval incorporates information gathering from the patient, talking about past medical history.
Okay.
And then they discuss, the reasoning why they're being evaluated on that specific day. And then from there, then they'll talk about goals that the person wants to meet, or any of the findings that were found during the evaluation.
All right.
So if it's if someone's coming for shoulder pain,
right,
then the evaluating PT will develop a plan, probably incorporating modalities to help with the pain, strengthening exercises, and then we provide a written home exercise that we can give the patient to do at home. And it's not going to be like a lot of exercises.
Right.
In the beginning, it might be 2 or 3, depending on, the severity of the pain, or what the person is capable of doing.
Okay. And so the initial interview assessment really looks at all the things going on, really evaluates the treatment that's necessary, and that's called modalities, right?
That it also includes the modalities.
The modalities are what?
Some modalities we use ultrasound,
Okay.
which is a form of DP, electrical stimulation, and we also have moist heat, cold pack. We have a diathermy machine. So those are what we call modalities.
Okay. And those are things that you apply.
Yes.
Per the direction and orders of the PT?
Yes.
Okay. Typically, an appointment with you as an assistant would be what, 30 minutes?
It can vary depending on the patient's tolerance. It can be 30 minutes, it could be up to 55 minutes.
Oh, okay.
A lot of it is based on what the patient needs or is appropriate.
Okay. And is it standard, the typical sessions twice a month or twice a week or?
Well, the frequency is based on the evaluation.
Okay.
If the evaluating therapist feels that the patient is appropriate for 2 times a week or 3 times a week.
Okay.
Okay, so and that's where it takes all that information and the findings they find during the evaluation.
And then there's a final evaluation, right? Upon
Yep.
completion.
Right, so at the end of the course, it could be before the certification ends, or depending on if the patient meets their goals sooner. The last day will be an evaluating therapist will see them, go through the findings again, see how they're doing, if there were any tests that were done. Typically, we'll do it the day before or on that day, based on the circumstances, things like that.
You mentioned certification. Everybody has to be certified in order to we have certain numbers of treatments that we can have, right?
Right.
Of physical therapy appointments.
Right. So during the evaluation, the evaluating therapist will, based on the findings, will determine if a person's appropriate for, where the physical therapy session will end either a month or 2 months.
Okay.
Okay. So typically we schedule for a month. And then based on how well the person is improving or slow progress, that we have the flexibility of going into the second month. And a lot of times, we don't completely use up the whole month, the second month. So it gives the therapist that flexibility.
All right. How many physical therapists are there in the clinic?
Well, right now, there's typically about 2 to 3 who are there full-time PTs, and then there can be 1 to 2 PTAs there, but a lot of us are cross-trained. So we have some Garden Ridge PTs who come over to outpatient, and vice versa.
Okay.
But there are, typically you see the normal therapists there who are there, about 2 or 3.
Oh, okay.
Yeah.
Can an individual living in independent living go over to Garden Ridge and be seen by physical therapy?
There have been exceptions, especially if a resident lives very close and it's taxing for them to go over to outpatient.
Okay.
That's the discretion.
Okay.
But a lot of, we recommend a lot of the residents to go over to the Hunters Crossing.
Okay. And physical therapy is located in Hunters Crossing?
Hunters Crossing down on the terrace level.
Okay, down the
right
bottom.
across from the conference center.
Okay.
And then we do have a satellite gym over in the Garden Ridge.
All right.
So
And where's it located in Garden Ridge?
it's on the 2nd level,
All right.
close to the beauty shop.
Okay. And that's in Evergreen, or is that?
Closer towards the Rose Court site.
Okay. All right. Very good. What kind of things do residents need to know about physical therapy that you haven't told us?
Stay motivated.
Okay.
Because that makes a difference.
All right.
Consistency is important. There are, especially with home exercise program, there's a reason why we either recommend doing the home exercises twice a day versus once a day. Because research has shown, dependent on, the types of exercise we provide, maximum results.
Okay. So if you have an exercise program, you're encouraged to do what's there?
Twice a day,
Okay.
then
Do it
try to
twice a
find,
day.
and be consistent, consistency is important, especially if you have you had knee surgery, take for example. The goal is to get the knee as straight as you can and bend the knee as straight as much as you can to gain as much range of motion, because then that'll affect how you get up from a chair, how you sit down, if you're capable of going up and down the stairs. You need that much range in order to be able to limit how much impairment you may have while you're functioning.
Okay, I've been through a treatment, okay? I feel like I'm ready to stop the treatment.
Okay.
And I get evaluated as, okay, you've graduated. A month from now, I have the same problem again. What do I do?
You can talk to your doctor,
Okay.
get another referral, and then we can see you. But you also have to think of, like, from when you were discharged to now when you're experiencing the pain, you have to ask yourself, have you been consistent with doing your exercises? If not, then that's probably one of the reasons that the pain has come back. The muscles have started getting weaker.
All right.
Okay.
Will Medicare still allow you to do that?
And to get another prescription?
Right. Another evaluation?
Yeah.
Okay.
I mean, a lot of it is going to be based on, the evaluation findings again. Okay. And, what have you done since the last treatment? Was there an injury that aggravated the same pain in that same area? And if it has, then there's a good potential that, we can see you for therapy. But, if it's more of you haven't been doing the exercises, but you're still doing the same thing. Okay, you have to strengthen the muscles around the joint if it's the shoulder joint.
Right.
And if you haven't, maybe, maybe you may want to try to do those exercises that were provided for you. And if that didn't improve the pain, then I would suggest coming, getting the referral and having therapy.
Bottom line is, if we have a pain, see our physician, get evaluated, see physical therapy, do the exercises.
and stay active.
And stay active, right?
Yes.
Okay. Well, thank you very much, Lisa,
You're
for coming.
welcome.
We're so glad that you're here, and we're glad you've been with Green Spring for 16 years, and hope that you stay another 16.
Thank you.
All right.
Thank you.
Thanks again.